So our group has recently created a machine learning algorithm using electrocardiograms to detect a variety of clinical pathologies, including a reduction in left ventricular ejection fraction, or what we'll term left ventricular systolic dysfunction. While it can be asymptomatic at first, it can eventually lead to symptomatic heart failure with its associated morbidity and mortality. In addition to reduced quality of life, the costs of hospitalization for heart failure in the US alone in a 2014 study was over $11 billion. The cost effectiveness of this artificial intelligence algorithm has not been previously modeled. My name is Andrew Sang, and I am a cardiology fellow at the Mayo Clinic, and it is my pleasure to present an overview of our manuscript entitled Cost Effectiveness of an Electrocardiographic Deep Learning Algorithm to Detect Asymptomatic Left Ventricular Dysfunction, which will be published in the upcoming edition of the Mayo Clinic Proceedings. In this study, we sought to evaluate the cost effectiveness of this artificial intelligence electrocardiogram algorithm, which I will term AI-ECG, for universal screening for left ventricular systolic dysfunction at the age of 65. Using an initial decision tree and subsequent construction of a Markov model, we modeled cost effectiveness under multiple cost scenarios. We performed one-way sensitivity analyses to tease out the individual impacts of different variables. Using the standard willingness to pay threshold of $50,000, in other words, the cost threshold that payers would be willing to pay for one quality adjusted life year gained, we found that the novel AI-ECG algorithm appeared to be cost-effective under most clinical scenarios for universal screening at the age of 65. However, it is particularly sensitive to the cost of screening echocardiography, as well as downstream testing, as well as a natural history of treated and untreated left ventricular systolic dysfunction. So in conclusion, we found that the AI-ECG algorithm may be a cost-effective tool if used in universal screening for left ventricular systolic dysfunction, with great impact on the early detection of reduction of left ventricular ejection fraction, even before the onset of clinical symptoms, including heart failure. For patients, the ability to detect asymptomatic reduction in ejection fraction means that clinicians can treat early and prevent the progression to symptomatic heart failure, which can ultimately improve quality of life and save lives, all while maintaining cost effectiveness. With that, I want to thank you for listening. Please check out our work, which will be published in the Mayo Clinic Proceedings.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.